Assalamu alaikum. This is Yumna Nadeem, roll number 145021 presenting you about my drug Nystatin and antifungal medication. Nystatin is actually a polyene macrolide which works against Candida species, especially Candida albicans. The mechanism of action of Nystatin is that it binds with ergosterol in fungal cell membrane and create pores, which leads to depolarization of membrane and eventually cell leakage. The absorption of Nystatin is negligible when given through GI tract. These are microscopic presentation of Candida albicans. Nystatin is indicated in oropharyngeal thrush, intestinal candidiasis, and vulvovaginal candidiasis mainly. It can also be indicated in candidiasis due to other conditions like HIV and chemotherapy. Nystatin is contraindicated in pregnancy and breastfeeding women. It is also highly contraindicated with patients having paraben hypersensitivity and diabetes mellitus, as both paraben and sucrose are part of formula. The side effects of oral Nystatin are nausea, vomiting, diarrhea in high doses only, and fast heart rate, fever, and sore throat can also be observed. If given vaginal Nystatin, transient irritation, burning, itchy, dry, or swollen skin can also be observed. Doses doses vary from each route and each indication, as in oropharyngeal thrush or mucositis. Oral suspension is prescribed in 4 to 6 lakh unit orally every 6 hourly. Also, chemotherapeutic candidiasis and in HIV candidiasis, oral suspension is prescribed in 5 lakh units. In intestinal candidiasis, oral tablets and powders are prescribed, and in vulvovaginal candidiasis, Nystatin vaginal tablets are preferred. Dose variation and adjustment is needed only for infants and premature and low birth weight neonates suffering from candidiasis. Infants only need 2 lakh units orally every 6 hourly, and premature and low birth weight neonates need only 1 lakh units orally every 6 hourly. But renal compromised patients need no adjustment in doses of Nystatin. Drug toxicity of Nystatin is not very high if given through oral or topical route, as it is absorbed insignificantly. But oral doses of more than 5 million units daily may result in nausea and gastrointestinal upset, which are only treated symptomatically by managing any fluid or electrolyte abnormalities in patients with severe diarrhea or vomiting. Nystatin powder for suspension should not be used to treat fungal infections of blood or given through IV, as systemic toxicity of Nystatin is very high due to lack of selectivity for fungal and human cell. And there is no antidote yet available for Nystatin. Drug-drug interactions of Nystatin is only due to duplication of therapy if prescribed through similar route with any other antifungal like iconazole, ketoconazole, miconazole, etc. Approved dosage forms of Nystatin are Nystatin cream, ointment, and powder, which are prescribed mostly for only topical mycotic infections. Oral suspensions are available for oropharyngeal candidiasis, and lozenges are available if suspension is not available or cannot be used by the patient. Also, oral tablets are available to treat fungal infections of intestine and stomach. Vaginal inserts or suppositories are only prescribed for vulvovaginal candidiasis. Few alternatives are available for Nystatin. The innovator brand of Nystatin is Miscertain, which is not available in Pakistan, only in Europe, but Davestan and Nystatin are available in Pakistan, where Davestan drops are least expensive and Nystatin tablets are most expensive ones. Drug alternative of Nystatin are oral clotrimazole, which is available for oral thrush and has a pleasant taste that could increase patient adherence. Fluconazole is more effective than Nystatin, especially in chronic conditions, as it absorbs in tissues more efficiently. The rational use of Nystatin is that it is more preferred for infections caused by Candida species, especially Candida albicans, other than other fungal species. It is mostly prescribed for topical mycotic infections instead of systemic infections. Irrational use is that Nystatin should not be prescribed for any pregnant lady or breastfeeding woman, and as Nystatin is available as the over-the-counter drug and it is used without a correct clinical judgment, which can lead to antimicrobial resistance. Nystatin is prescribed for systemic infections when more efficient drugs like fluconazole are available, so it should not be prescribed. Now we'll study about a case of a 50 years of age male patient complaining about patches over the tongue with burning sensations. The chief complaint of the patient is that he sees white creamy patches over the tongue with burning sensations occasionally. He had a bad breath and burning sensation and pain on taking hot, spicy, and sour food items. Onset of chief complaint is 6 months before visit, and he has a history of smoking, which he quit 3 years ago. He is currently suffering from hypertension and hyperlipidemia, for which he is taking medication lisinopril and atorvastatin, and he is self-medicating ibuprofen to relieve the pain. On examination of vital signs, his temperature is normal, but beats are high and respiratory rate is a little low. Blood pressure is also increased. On physical examination intraorally, white patches on dorsal surface of tongue are seen, and presence of calculus and stain in patient's mouth can be seen. Lab test shows normal sodium and HbA1c percentage with LDL in LDL is higher than normal range and LDL is lower than the normal range. Assessment is that there is a possibility of oral thrush on dorsal surface of tongue caused by Candida species, or there is a chance of leukoplakia as patient had bad habit of smoking, which can lead to leukoplakia. The problem list is that white patches on dorsal surface are seen, and inflammation on scraping the white patches can be seen. Self-medication of ibuprofen causing increase in blood pressure and poor oral hygiene can be seen. Diagnostic plan is firstly we have to perform a scrap test to differentiate between candidiasis or leukoplakia, and if it is leukoplakia, biopsy is required to rule out the cancer. Treatment plan is that patients should firstly be educated about the maintenance of oral hygiene, proper diet intake, and lifestyle changes to maintain his blood pressure and hyperlipidemia. Also, proper counseling should be provided about hazards of self-medication. If there is leukoplakia, which is usually harmless and clears within few weeks or months after source of irritation is removed. If it is not clearing, then it could be surgically removed. But if it is oral candidiasis, few medications are prescribed like Nystatin suspension in 4 to 6 units orally every 6 hourly, swish in mouth and for several minutes and then swallow. Multivitamins are also prescribed, which can help in reduction of inflammation and strengthen the immune system or helpful in healing. Probiotics are also to uh, uh, prescribed, and curd, yogurt, or buttermilk are also prescribed as they are rich in lactobacillus that is good for thrush. Analgesics were prescribed, which can reduce inflammation and are safe for hypertensive patients. A follow-up is required as regular checkup should be scheduled until patches disappeared. Patient should be examined if oral candidiasis is diagnosed for antifungal treatment, or if leukoplakia is there, frequent monitoring is required as there is chance of development of malignancies in these cells. These are the few references I have provided. Thank you for your time.